Welcome again, Dr. Locke. Thanks for joining us. Do you have any updates you can share on any of the earlier cases that were happening in the region? Are they close to recovery?
Yeah, we are happy to say that some of our cases have resolved. I think as of yesterday, we had 3 resolved, and that is consistent with the way the COVID virus works. For the most people, it gives them a bad flu, and then the first part of the flu can be rough, but they do get better. And so we're happy to see that happening in our community as well.
Now, are the people who have recovered recruited to help with the vaccine or antibody for COVID-19?
Well, the ministry at Public Health Ontario, which does all of the scientific work for us, and at the Public Health Lab for the province, they're doing a lot of work to look at all the different kind of tests that can measure antibody development in your body. They haven't yet found a good test that they can use on everybody in our population. But once they do, there definitely are plans to try and determine who has antibodies and how long those antibodies last. So do you have immunity for several months, for a year, forever? All those are questions that we still need to answer.
Understand. Now, over the weekend, a woman posted on Facebook that her relative, a frontline worker at the Tillsonburg Walmart, had tested positive. Now, her post was shared over 1,500 times. Is this a good thing or a bad thing?
It does speak to the fact that people really want to know if there are cases in our community. We would hope that the place that people turn to for that information would be our website. We try and keep that up to date. Every day around 10:30 or so, we refresh the information from the day before. So it's the best place to get the information about who has cases, and that's reliable information that you can trust. You're not always sure when people tell you something on Facebook if that's the truth or not.
Now, with that employee testing positive, what type of impact could that have on the area?
Well, that means that somebody in that area had COVID-19, and our concern, of course, is always who was that person in contact with, and did any of those people that were contacts get the infection. So our staff gets in touch with the person who has the COVID result that's positive, and then they reach out to every contact of that person and phone them and give those contacts instructions about self-isolation and symptoms to watch out for and when to call public health. So we hope that through our work and through the cooperation of all those contacts that we can curtail or contain the spread of the infection within that community so that it doesn't impact the other people. But that said, we are on alert that there may be people coming in and out of our communities that don't have typical symptoms of COVID. And so we don't want people to be too relaxed. We do want everybody to continue to be cautious and maintain those like physical distancing and other actions that we are trying to do so that we're all on alert to keep the disease from spreading.
Right. Now, I see that the health unit has started identifying cases by town and cities as opposed to regions. What's prompted this?
Well, people keep asking us, well, was that someone in our city or our town or our neighborhood? So we had to balance trying to maintain as much privacy for the individual who was positive while trying to be as open and transparent to our community about the information as possible. So we weighed the pros and cons, and we thought about it from different angles, and we think that we can probably share it at a little more smaller geographic location, while maintaining the privacy of the individuals. So it's our effort to try and be able to communicate as much information as possible to our public so that they know what's going on in real time while maintaining the privacy of individuals.
Various health units have recently said that this is the most important week in the fight against the virus. Do you believe this is the case?
Well, the reason that it's becoming important now is that it takes about 14 days for the COVID virus infection to start to show up in people. And about 2 weeks ago or so, the province began to institute all of those measures where they closed the schools and they closed other places and really started to hammer out the message to our communities that we really do need to stay apart from one another. And so if the community was listening, then we should start to see that our numbers aren't going up so fast. But if our numbers start to skyrocket, then we know that we need to be even more aggressive, because people may not have been taking our words of advice as seriously as we would have liked.
Now, the province has released its modelling for COVID-19. Does Southwestern Public Health have its own local modelling for worst and best case scenarios?
We have been looking at models locally, but they're not really the best models. The reason is we don't have that many cases here yet, so it's very difficult for us to make a model with very little information. So we've been using models with information from other countries like China and Italy, and then trying to say, well, if the same sort of thing was happening here, but just at our smaller size, what would be happening? And we realized that those models weren't very good, because the situation in China and Italy is different than here. So right at the moment, we don't have our own models, and we're using the models from the province to make our predictions. But we do hope that perhaps as this time goes on, we can have a Southwest Public Health specific model.
Gotcha. Now, the London Health Sciences Centre has just finishing construction of its temporary field hospital. Have you considered the possible need for this in Woodstock or St. Thomas?
So the ministry, Ontario Health, does want our health system to be prepared for the surge if the surge comes. And so it has given specific direction to some of our larger centers to start building extra capacity. That said, our local hospitals have been looking as well, but not yet building an extra building like they are in some other areas. We would probably have to decant to the London area if we overflowed here. But that said, our hospitals are looking around at other spaces within our community which may be called into action if needed.
Understand. Also this week, Dr. Tam has encouraged the use of homemade masks when you're out grocery shopping or in situations where close contact could be incurred. Can you give us your thoughts on that?
What we are learning is that the coronavirus is shed not only through the secretions from your nose, but it's shed through your saliva from your mouth, so that when you talk to other people, you are aspirating the saliva and along with it the virus into the air. So with this newer information, we're beginning to realize that to protect other people from you, it would be helpful for you to wear a mask. So in the winter, when we have flu season, we tell people to cough into their elbow, and that's to protect other people around them so that when they cough, the the virus and the droplets go into your elbow and not onto other people. So this would be sort of the same thing. When you talk, instead of having your saliva and the virus spread in the air in front of you, it would be caught in the mask you wear. So it is something to start to consider, but we have to really emphasize that this does not mean that you shouldn't stop the physical distancing, and you shouldn't stop the hand washing. Because when you wear a mask, it doesn't protect you so much. It protects the person you're talking to. So if you want to protect yourself, you still need to stay 6 feet away, and you need to be sure that you wash your hands a lot.
Understand. Now, we had a lot of rain last night. A question came in, does the rain wash the viruses off outdoor materials?
I don't know the answer to that. We do know that the virus is relatively easy to kill with a weak solution with water and bleach. We do know that it lives on some surfaces only for a few hours and other surfaces for several days. But exactly what the rain does, it might depend on how hard it rains or how long it rains, whether it can wash it off. We do know that if you wash your hands really quick and you don't do it thoroughly, there's all kinds of virus left behind. And so I think it might make a difference whether there's a sprinkle or a solid hard rain, but I wouldn't count on it. I think you still need to make sure that you wash your own hands, that you use your hand sanitizers, and where this is all going on, follow the guidance from our municipalities to stay away from those jumbo gyms and stuff that people like to climb all over. Just for now, even if it's rained, better stay away from them.
Great. Now, do you have any other comments you'd like to share at this time?
I know it's getting to be hard for everybody to do the social distancing. However, the models did show that the numbers could potentially be really bad. We're really hopeful that the strong cooperation we have received from our community members is going to make an impact, and that we won't see the cases on our website go up and up and up. So again, I thank everybody for their cooperation. It's good when I walk down the streets at night and I see that they're not that crowded and people are only working and walking in small family groups. It's great when I'm in the stores and I see people, trying to stay apart from other people. So thank you, everybody, for all the good work you're doing to fight this together. And we'll see over the next week what happens with our numbers. We're in it together, and I'm hoping we'll succeed that way.
Thank you. Thanks, Dr. Locke. Thanks for your time today.
You have a great day.